Genes may shape a person's experience with COVID-19, and this could explain why some people with coronavirus never develop any symptoms at all. There's a new study, scientists looking specifically at the human leukocyte antigen, or HLA genes. And the genes play an important role in helping the human body recognize and fight pathogens. They found 20% of the people in this study who had COVID but were asymptomatic had a specific HLA variant. Joining me now to talk more about it, Dr. Taison Bell, critical care and infectious disease physician at the University of Virginia. Thanks for being here. Tell us more about these genes and what it's showing us about our bodies and how we react to COVID.
Oh, thanks, Marni, for having me. And we've all long wondered why some people who get infected with COVID become very ill and some are asymptomatic. And this study sheds some light and starts to begin to answer that question for why. So the research team basically took samples from people who were infected with COVID, and they compared the genes between those who were asymptomatic versus symptomatic. And as you said, 20% of the people who are asymptomatic had this specific gene that helped them recognize the coronavirus a little easier than some of the people who did not have that mutation. Now, you get genes, 2 copies of each gene, 1 from each parent. So people who had 1 copy of this gene were about 2.5 times more likely to be asymptomatic with COVID compared to people who did not have the gene mutation. And then if you had 2 copies, then you were 8 times more likely to be asymptomatic. So very strong evidence linking genetic footprint to actual how you experience COVID.
It's really interesting. How might this impact the science behind vaccines and treatments for COVID?
Well, that's the really neat part, because essentially these patients or these study participants were able to recognize the conserved parts of the coronavirus. So as you may know, SARS-CoV-2 is just one version of coronaviruses. There are many different kinds that cause the common cold, but these immune systems for people with these gene mutations were able to recognize the parts that actually don't change that much. And so that makes it a very attractive target to develop new therapeutics, new vaccine targets. And there's precedence for this. For example, in HIV, a new class of drugs were able to be developed based on studying people who were infected, but their immune systems were able to control the virus and they did not develop full-blown AIDS. And so we could use similar sorts of techniques to figure out the best ways to target our therapeutics and vaccines.
Yeah, leading to a lot of important advancements. What's happening with COVID right now and the rates nationally?
Well, as I think anyone who's probably looking around knows, we're out of the danger period for COVID. That doesn't mean that people aren't getting sick. In our ICU, we're admitting patients every now and then. It's not as common as before, maybe once every couple of weeks or so. We're in this phase where we're kind of watching and waiting. We're seeing hospitalizations, deaths go down. There are new variants coming. We're all getting sick of the alphabet soup, but it's important to keep track of these to make sure that there's nothing that would either change how the virus behaves or change who it may infect or how severe it may be.
One more topic real quickly. I have less than a minute left, but teenagers are increasingly using social media, things like TikTok and Instagram, to diagnose themselves with medical conditions. This is things like depression, ADHD, anxiety disorders. How often as a physician are you asking patients, did you Google this before you came and saw me? And how problematic is something like this?
Well, Dr. Google did exist before a lot of social media, started self-diagnoses, but this is something that's very common. I run a summer program for teenagers and young college students who want to become physicians, and this is something that is on top of mind. And I think the danger is that so much of the content, we are having a conversation about mental health, but the content can lead you to these dark holes where you're either self-diagnosing or it actually exacerbates pre-existing mental illness. And so it's very important that we have resources accessible in schools, guidance counselors, that we teach teenagers how to appropriately assess the content that they're seeing, and that we encourage social media companies to put up safeguards to protect children and teenagers.
Yeah, well, you have a degree in medicine. Dr. Google does not, so we'll leave it to you. Thanks for the advice and messaging this morning, Dr. Taison Bell.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.